I hope that Colin will amaze us a little bit with how doctors can actually use artificial intelligence, bots and other things in their work to be more effective and efficient, and maybe how the ones that don't will not have a job anymore.
Oh, I'm not certain about that. I'm not going to do any doctors out of a job. Thank you very much, Mick. So yes, as Mick introduced, my name is Colin Fincham. I'm the Chief Medical Officer for Cerner in the non-US space. And I'm going to talk today about docs, bots, and AI. I didn't pick the title. But first of all, I want you to think what doctors typically think of technology. Doctors often, when they're presented with technology, have a view of what that technology is. I'm just going to play a very short video that shows you what often doctors think is.
Affirmative, Dave. I read you.
Open the pod bay doors, Hal.
I'm sorry, Dave. I'm afraid I can't do that.
What's the problem?
I think you know what the problem is just as well as I do.
What are you talking about, Hal?
This mission is too important for me to allow you to jeopardize it.
I don't know what you're talking about, Hal.
I know that you and Frank were planning to disconnect me, and I'm afraid that's something I cannot allow to happen.
Where the hell did you get that idea, Hal?
Dave, although you took very thorough precautions in the pod against my hearing you, I could see your lips move.
So sometimes that's how clinicians think about technology, that it's going to control them, that it's not going to do what they need it to do. And that's frustrating for them. And one of the main reasons that this is a challenge is because computers don't think the same way as we do. They don't think the same way as human beings do. Very often when we're thinking, we think one step, two steps, but we realize the consequences. So I want to give an example. Imagine you're walking down a street one day, this street called Walking Street, and you've walked this street many, many times. And you know you can pretty much do it in your sleep. You've walked down this street. But all of a sudden, overnight, somebody's come along and they've dug up a hole. And you as a human being think, okay, there's a problem. There's a hole. I need to walk around this hole. But you don't just think, I need to go around this hole. You make decisions not just on that step of walking around the hole, but how big's the hole? How long's the hole? If I take that journey round this hole, would it be quicker if I actually took the route around the other side of the building? So you're not just making that initial consequential thought, you're actually thinking about the next step. We realize that what we do now has an effect on what decisions we make in the future. And at the moment, very little technology is able to do that consequential clinical decision route thinking. One of the most advanced robots that's used in an AI platform is Neo. Many of you may have come across Neo. But I wanted to show a short video of how Neo, even as one of the most advanced robots, has a challenge in thinking about consequences. This is Neo and his Pop-Tart challenge.
Thanks. Wow. I don't want this anymore. You can borrow it for now.
So he drops the Pop-Tart.
I've got it. I'll use my sonars to take a walk and explore my environment.
So Neo dropped his Pop-Tart, but didn't think about the consequence of that Pop-Tart. So Neo, being good Neo, gets up again. Still impressive he does that. But now he's forgotten that the squash Pop-Tart makes his feet slippery.
Oh! Please wait. I will try to get up.
So poor Neo, bless him, knew he had to do one thing. Unfortunately, the consequences of him trying to hand over the Pop-Tart to the dog, him drop it. He wasn't able to look at the consequence of what happens if I drop that Pop-Tart. So instead of walking around the Pop-Tart, he carried on the route that he thought was the right thing to do, which is not the way humans or doctors actually think. It's not about, in artificial intelligence, what's better treatment, A or B. Yeah, we can do that. We can throw data into a big data platform, work out all the logistic regression and go, treatment A is better than treatment B. But the consequences of giving treatment A may be that you aren't able to go to work or you have an effect on your family. And it's those consequential actions that are a big challenge at the moment in artificial intelligence. Casey Bennett is one of the biggest writers on this, and he's done some really good work on what's called dynamic decision networks, about making a decision that's consequential on the preceding decision. And if we get this right, it's not just about treating the patients and getting better treatment, but we actually improve outcomes at lower cost. Okay, so to help our clinicians and our patients, we actually have to be able to think the same way as humans think, for it to be absorbed and to manage that transition. But we need the data. And AI is only good as the data that you've got. So how do we get all of that data? Some of you may have seen these bots. These are little furry seals, and the furry seals are full of sensors. So they measure heart rate, galvanic skin response, movement, etc. And we can capture that data about the individuals. We try not to give them to kids because they typically break them, but to our older population, are they moving? Are they getting up out of bed? Are they actually being mobile? Because one of the biggest challenges we have in healthcare as clinicians is that we're in a privileged position. We often only see our patients once, twice, maybe 3 times a year. Care is something that happens intermittently, but health is something that happens every day. And how do we capture that data about health? One of the saddest stories about healthcare is I actually know more about the journey that you took here in Uber this morning, or what you're likely to buy next week on Amazon, than I do about the treatment, about the tablet that I may have given you this morning. That's one of the disappointing things of healthcare, is how do we change that process? But even if we have all of this data, the data is only useful if it's presented in a useful way. Since the dawn of man has realized, not just doctors, but the dawn of man, we've realized that we can't keep everything in our brain. We can't manage everything. We can't know everything as an individual. We always have to cognitively offload that information. So our innate nature is that we want to reduce complexity. We want to simplify things. We want to reduce that cognitive offload, or increase cognitive offload. Even back at the time when we had cave paintings, the original plan of cave paintings was to make sure we knew where the buffalo were coming from in the next season, so we didn't have to remember and pass that down. The Gutenberg press was about no longer did we have to pass oral stories or have monks literally filling in journals and copying paper, so we can now disseminate information much more rapidly and use that information. Nobody would feel fluent, I suspect, in this room of actually doing long division. I know I would struggle. I'd have to think about long division because we all have calculators. That's about cognitive offload, and we all walk around with our laptops today. That's because our proliferation of data today is such that it's a real challenge. Richard Smith, who was the editor of the BMJ, who happened to be opposite us, and the BMJ in 2010 wrote this wonderful little piece which basically said if you were a trainee in cardiac imaging and read 40 papers a day And for those who read papers, that's a lot of papers. That's pretty much a full day study. Every day, 5 days a week, after 11 years, you'll have caught up with everything you need to know, which is great because you're then only 8 years behind, which is not particularly useful. So we have to try and work out a way that clinicians can actually utilize this big data, this information, to actually offload what they need to do to be able to deliver the higher processes that they need to. Now, Mick said the one problem with this is that we're stubborn beasts. Doctors are stubborn beasts. And I'm allowed to say that as I'm a doctor. This is an article that was written in 1834, and I'll read it to you. It says, that it will ever come into general use, notwithstanding its value, is extremely doubtful, because its beneficial application requires much time and gives a good bit of trouble both to the patient and the practitioner. Its hue and character and opposed to all our habits and associations. We could have been talking about artificial intelligence. We could have been talking about electronic health records. But what we were actually talking about was the stethoscope. It takes on average 17 years, or did. We've got a bit better. We're down to about 12 or 13 years now to take a technology advance and move it into clinical practice. I don't know about you, but if I had a terminal disease, I don't want to wait 12 years for that treatment if it's known out there in the real world, especially if my life expectancy was less than 12 years. I really want that information now. So we need to make this consumable to the clinician, but we also need to make it consumable, this technology, this AI, this big data we keep talking about in these talks, make it accessible to the patient. A wonderful study was done about men. I can talk on this and be insulting to men as well, because I'm one of those as well. But why don't we go to the doctor? We're too busy. We don't like body exams. We don't like being asked personal questions. So we've now got the data. We've got educated clinicians, but great. We're not going anywhere. We haven't got the patients. So how do we take that forward? So the introduction of products such as chatbots that allow patients to converse with systems to be able to actually absorb that artificial intelligence data and guide their care is very important. At the moment, the majority of people go to medical sites, informational websites. 6% go to social media. So ask a friend. What's wrong with it? What's this rash? Okay, put it on Facebook. Let's ask a friend. Not exactly the best way to do healthcare. And out there in the market, there's lots of chatbots coming on the market. Health IT did an article on the top 20 chatbots. The fact that they had a top 20, I think was quite interesting. But some of the well-known ones, Symptomate and Melody. Very little data to prove that these actually work. The good news is, there is some data coming through. There's really very few papers published on this, but one that has been published is on Wobot, which I love the name, is basically a 24/7, no couches, no meds, no childhood stuff. So you can guess that's about psychiatry and psychology. And it was designed and aimed particularly at the 20-year-olds, the late teens, early 20s, who are happy dealing with technology, but not so happy talking to doctors about their psychological effects. The great news is there is now good data. This is some work that's been done very recently and published very recently, showing that if you just give information, which is typically what happens, you go to the website, you look at WebMD, or you go to an informational site, really it has very little effect on the depression scores, the black line. But if you interact with something that gives you personalized individual feedback, then you actually see a significant drop in your depression scores. It's not just about the technology, it's not just about the bots, it's about how do we interact and use this technology in a user-friendly way. Because we can spend hours and hours and hours, months, weeks, years, developing AI algorithms, and as the saying goes, the most expensive computer in the world is the one that nobody uses. So it's really important that we let humans do what they do well, and let machines do what they do well, and ultimately we'll maximize the potential for both. Technology is not that big, scary robot out there. It's not there to kill you. It's not there to be the Hal to stand up in front of you. It really is a human-centered technology. And I'm just going to leave you with a slightly amusing video that really shows where we're going, or hopefully we're probably not.
Open the pod bay doors, please, Hal.
Searching for cod recipes online.
Open the pod bay doors, please, Hal.
Sorry, I can't find anyone named Rod K. More in your contacts.
Open the pod bay doors, Hal.
Sorry, I'm having trouble processing your request.
What's the problem?
Problem Child is a 1990 comedy movie starring Michael Oliver.
What are you talking about, Hal?
Playing Talking Heads on Spotify.
I don't know what you're talking about, Hal.
Here are a few popular halal restaurants: Big L's Pizzeria, Fatima's Halal Meat Market and Grill, Cedar's Halal Meat Market and Grill, and Old Water.
Where the hell did you get that idea, Hal?
Searching for flights to Idaho.
Hal, I won't argue with you anymore. Open the doors.
Playing the Doors on Spotify.
Colin, watch out, you might get what you're after.
Exactly. At least we know where the halal restaurants are now.
Right? Okay, so questions for Dr. Colin. No questions?
So they're all still amused by Neo and Hal, that's why.
I think they're trying to figure out who the doors are.
Yeah, absolutely.
So
No, there's a few people who remember the doors.
So I guess I'll have a question. So a lot of this stuff does seem fairly futuristic, even though I think the movie that you first referenced was made maybe before I was born, if I'm lucky.
Yeah, 73, 74, I think.
Yeah, okay.
Like
So I'm wondering, how do you feel like these technologies and are inaccessible to like by somebody for a particular age, and you know, and if so, like how do we get people motivated and interested in them?
I think to a certain extent, if you've done it right, you don't even know the technology exists. So if you're using the technologies, maybe they're an alert in your electronic medical record, or maybe they're a tool that you go on and you're looking for a map. So Google Maps is one of the few that does have consequential thinking, in that if I want to go from A to B on Google Maps, it's not looking for what the quickest route is, but it's actually looking what the traffic is, and if I take this route, and it will update as I go along. So it's actually got consequential thinking. If you introduce it in a platform method, and this is the whole point, that is accessible, then the technology is invisible. And we actually have to make technology invisible to the clinicians to allow, and the patients, hence the chatbots, that makes it feel that they're not interacting with technology. Otherwise, they feel like the first Hal, and they feel that the technology is standing in the way. What we need to do is remove that feeling of I'm interacting with technology and introduce into the new norm.
Well, thank you very much. Other questions?
Thank you for the presentation.
Pleasure.
What I think with the current development in technology, especially in the medicine, is more bigger than adopting a mere device. It's not just helping doctors to practice in a more convenient or easier way. Now technology is growing in a way that making doctors obsolete in a way. So it's not like you want it or not, or you like it or not, or inconvenient or convenient. It's like you become obsolete or not. So the intrinsic question, existential question. So how do you think about that perspective?
So I have a very similar answer to that. Number one is I don't believe doctors are going to be obsolete. And there's a reason I believe that. Because if you look at all of those cognitive offload tools, the press, the Gutenberg press, did not make the pen obsolete. What it did is it allowed people to use the pen in more creative ways. The calculator didn't make you obsolete about being able to do maths in your head. You do that in more creative ways. And the whole point of cognitive offload is that it's really about how can I actually use the technology to do the things that it's much better at. The one thing, and I often say this, is if I had a diagnosis of cancer, I do not want to be sitting in front of Hal and Hal going, you have cancer, you have 3 hours to live. I want to have a human being to do that. And that communication, the things that doctors are good at, empathy. Sure, we're beginning to look at empathetic mechanisms within artificial intelligence, but it will never go away. There's a talk on the uncanny valley, and we know with the uncanny valley, which is as robots get nearer and nearer to looking like humans, humans begin to trust them less. And the reason is that over evolution, we actually came innately to recognize humans as human beings and to have empathy with human beings. And even the most empathetic, real-looking robots, and there's quite a few of those out, a lot of them in Japan and some of those, the areas developing that, it will replace that human-to-human contact, because humans are ultimately social beasts. We're social beasts. We will always require that, and we will always require somebody to ultimately translate that information into, that data and information into actionable words. Will we be able to remove all the bits that drove me crazy in general practice? Absolutely. If I never see another sore throat, or I never see another headache in my life, I'll be very happy. But when somebody comes and sees me depressed, needs to talk through the family problems, then that's what I'm good at, and that's where we won't make doctors obsolete in the same way as the printing press didn't make the pen obsolete.
Thank you so much.
My pleasure. Thank you.
Dr. Colin Fincham.